And for athletes, it's not unknown to experience a sprained ankle, maybe your elbow gets tweaked, or even a shoulder injury while participating in these summer sports. With the constant grind of practices and sporting events, these types of injuries are quite common. So joining us today to talk about the different treatment options available for those with tendon or ligament injuries is Dr. Jeffrey LaValle, the sports medicine director with the Physical Medicine and Rehabilitation Department at Hartford Healthcare. Thanks for being with us, Doctor.
Thanks for having me.
So what are the most common tendon or ligament injuries that we see in the summer?
Yeah, so there's two varieties of injuries when we talk about tendons and ligament injuries. Usually there's an acute version which happens suddenly, which has a lot of swelling and inflammation around with it, or chronic overuse injuries such as golfer or tennis elbow. You know, with the acute injuries like an ankle sprain or like an ACL tear, we usually have two different types of modes of treatment.
So, and how do you typically treat an injury like an ankle sprain or that tennis elbow you mentioned?
Sure. So for the acute injuries, it's really important to control inflammation and swelling. So we use the acronym RICE. It's R-I-C-E.
Yeah.
Stands for rest, ice, compression, elevation. So it's important to do that right away after the injury. If you're having any real significant bruising or swelling, it's important probably to get evaluated at a clinic or just to have some imaging to make sure that it's not severe. For the chronic overuse injuries, usually that entails physical therapy, NSAIDs, non-steroidal anti-inflammatories, bracing, physical therapy with eccentric exercises, injections, and in for severe cases, surgery.
Yeah, and talk to us about using an ultrasound to treat the injuries.
Sure. So within the bone and joint here, I have an MSK or musculoskeletal ultrasound right in the clinic. So the advantage of that is the ability to actually assess the tendon or ligament injury often in the first visit. It also allows you to get a quicker diagnosis. So it's an important instrument that I use to help both diagnose and treat these injuries.
All right, so don't forget, you want to get treatment if you need it. RICE for the time being, and then maybe call someone like you. Doctor, thank you so much for being with us.
You're very welcome.
For more information, you can visit the Hartford Healthcare Rehab Network.